My name's Deondra Thilmony, and I'm from Mandan, North Dakota.
And where do you work?
I work at a specialty office called Terman Endodontics.
And what's your job title?
I am a registered dental hygienist.
And what is a typical day like for you?
We see it's a faster paced office, but we don't see as many patients as like a common dental office. A typical day would include taking a patient back, setting them up for a consultation and treatment. We usually talk with them, go over medical history, take x-rays. We're usually focused on one area of the mouth rather than numerous x-rays that you do when you do like an annual exam. We're usually looking at a tooth that is causing them discomfort or something that they're referred to by another dentist. So we do take x-rays, and then Dr. Terman, who is our dentist at the office, comes in and does some exams on that tooth. We test the pulp and things like that to see if they do need a root canal, and go forth with that. And then if they do, we either set them up for treatment or else they are set up for that day.
Wow. So how many hours do you normally work in a week?
It varies. All workers are considered full-time. We work anywhere from 35 to 40, sometimes 40 plus. In the summers, we do have about half day for Fridays, so that kind of varies your hours. But for the most part, it's 35 to 40 hours a week.
Do you take work home with you?
No, the nice thing about the dental field and what I do is that everything that we do is left there. Insurance, calling patients, at the end of the day, you get to kind of clock out and enjoy the rest of your night. You don't have anything to do at home.
How would you describe the pace at which you work?
The pace at our office kind of varies from day to day. We spend a lot of time with each patient. It's a little bit of a longer procedure compared to just a common teeth cleaning. My kind of job title is the dental hygienist, but I don't necessarily practice with just the teeth cleaning. We do root canals and different surgeries. So when we're with a patient, we're with them for about an hour to 2 hours sometimes, and then in between we do see patients for consultations. So we're constantly moving, cleaning rooms, and getting the next patient in. So it's high paced. We have a lot of people that come to us in discomfort. So the more people that we can see and help treat, the better.
Where did you go to school?
I went to Minnesota State University, Mankato.
And how long was your schooling?
I have a Bachelor's of Science in Dental Hygiene, so I did do the 4 years.
And how has your education prepared you for your career?
Unlike some degrees, I know when you get in, you do a lot of on-site training, and they kind of teach you what you're doing. With dental hygiene and dental assisting, you do a lot of book work right away for school, the prereqs and everything to get into the program. And then once you get in the program, your degree is very focused at the book work right away, and then your third and fourth year are a lot of clinical, so you're a lot of hands-on. So when you get out of school, you're still training and learning the different type of work you do at your office, but for the most part, you feel pretty prepared. On top of schooling, you do boards and things like that. So when you do finally get into your profession, you do know a lot about it because you're always practicing it and doing a lot of clinicals.
Have you worked in other jobs like this?
No, I haven't, not before. I did shadowing, and that's how I knew I wanted to do it, but I had never worked in the dental field before that.
Why did you choose this career?
That's always a question that people ask me when I'm sitting with patients, and I knew that I wanted to be in the medical field, but like a lot of people, I was unsure of what I really wanted to do. I kind of wanted to do nursing when I first started. When I got to college, it was really nice. They had like a 101 nursing, a 101 dental hygiene, and I thought those would be two things I'm interested in. So I did take the intro classes and kind of learn more about what you could do. They go over a typical day. They go over salary. They go over numerous things that people are interested in and want to know about their profession, as well as shadowing, which was the determining factor for me. I actually shadowed a hygienist here in Bismarck, got to kind of go around with her and see how a day was, and when I saw that the flexible hours and she had a family, it kind of determined that that's what I wanted to go into.
What goals do you have in your career?
The nice thing about dental hygiene that people probably don't know is that you don't just clean teeth. There's numerous things that you can do with that Bachelor's of Science that I got, a degree of dental hygiene. You can become a sales rep. So some goals I have set for myself is if I ever got to a position where I wasn't enjoying going to my job, that I would look somewhere else, a variety in my field. I know that I really like the dental field and that's something I'd want to stay in, and that's the nice thing about it. There's sales. You can sell to different offices the products that you use. Nice part about that is with hygiene, some of the companies recommend that you have a hygiene background so that you know the products. You've used them so you can tell them why we use this product, why we use that product, and why we really want to sell that. You can also go on and get your master's, so there's always that continuing part of your degree as well. With your master's you can teach. If you wanted to go forth and teach at a university, like some of the professors I had that help with clinicals and help with classes, you could always go on and teach. So it's a variation of knowing hygiene and then also maybe using it with teaching or things like that. And then in where I went, there's adjunct faculty that helped when we did clinicals, and so they were just your normal hygienist, worked Monday through Thursday, and then we had clinicals 6 to 9, and they would come in and work on us with our skills and then help us pass like competency tests to take on each kind of patient that we had. So you could, on top of going to work all day, go to a clinical setting at a university and help those future hygienists kind of develop their skills as well.
What do you think it takes to be successful in this field?
It's definitely a very hard program. I think that any hygienist or even dental assistant that you talk to, it's a lot about managing and organizing your time. When you're not learning the books, you're crunched at finding patients to pass different exams. They want to make sure that you know each skill, whether it be taking x-rays, doing teeth whitening. You're always having to do an exam. So just really being focused that you want to do that, because one thing too when you're done is that you have a degree in dental hygiene. So if you get out and it's not what you want to do, you do have a Bachelor's of Science if you go for the 4-year, but it's really aimed at the hygiene field, where you could still do the salesperson and things like that, but it's focused on a field. So you want to know that that's what you want to do beforehand before you get in, because it's a lot of time and dedication.